Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, welcome. We are so excited to have you here because we're bringing some of the best leaders, having amazing conversation with these leaders that are actually painstakingly reshaping the future of healthcare. We're pretty passionate about a few different areas. We're passionate about access, about leadership, about innovation adoption. And if it's your first time tuning in, let me just take a very quick step back, give you the lowdown on what we're trying to get done here. So, our aim, our focus is on bringing real stories of leadership and innovation to life, giving folks the opportunity and our guests to share their stories, share their learnings, share their little wins, and share some of the losses. Because obviously, when things aren't going well, you're learning. So, if you haven't had the opportunity to check out any of our historical interviews, wherever you are, however you're consuming this, if you're watching this, if you're listening to this, please hit the subscribe button now so that any of the new interviews come directly to you. So, really excited about today's conversation. One of the things that I keep coming back to, been doing this show for a minute now, it's this, is that healthcare is full of brilliant people, amazing people that genuinely care about the patients. And yet somehow, somewhere between the mission and the day to day, our industry just keeps burning through people. It's terrible. Nurses, physicians, techs, administrators, and the likes, these people show up every single day and they give everything they have. And for some reason, on the other side, they come out broken. And this is a number, this is a stat I was researching that I want to sort of want you to sit with it. 75%. Okay, that's how many healthcare workers reported serious burnout by 2022. So three out of every four people that are inside of your hospital, your clinic right now are carrying something that is wearing them down. Like that's a huge number. So most leaders see that number, and what they do is they maybe go into the wellness program bucket, or they put together a resilience workshop, or maybe they deploy an app. And today's guest sees something completely different. She is a trusted authority when it comes to human workforce. She sees a system that never actually designed to keep its people. Just think about that for a second. And she spent north of the last 15 plus years building the science that is going to change it. No, no, not if, like she's going to change it. And she's published dozens of peer-reviewed studies. She's co-authored five books. Her CV's, it's just ridiculous. But two of them are organizational behavior textbooks that are being used in over 160 schools across the country right now. So her most recent book is called Genfluence. It is about leading across generations in healthcare. This is so timely. It's right at the exact moment because Dr. Katherine Meese, who's our guest today, she is on a mission. She is on a mission to rehumanize the work of healthcare using science, using data, using research that most leaders have never had access to before in a form that they can actually use and implement and deploy at scale. So Dr. Meese is the CEO of Margin Group. I'm saying that slow because if I say it fast, I don't say it well. She teaches and mentors at UAB, and she's honestly one of the sharpest, most original thinkers working inside of healthcare workforce today. So, Katherine, great to see you. Welcome to the show.
Thank you so much for having me. I feel like I need to record that preamble and just like play it back to myself on a bad day. So thank you so much for the kind words. It's an honor to be here.
It's a pleasure to have you. Unfortunately, we are recording it, so maybe it could be
Or maybe
like
I will play back.
yeah, maybe you will play it back. That's what we wanted. We wanted people to feel comfortable here. This is all about what we're trying to get done here. So, um, Catherine, before we kind of dig into the meat of things, before before you authored all these books, before UAB, before your research, kind of where you started. You got a master's in public health, but then somewhere in there, um, and I was just kind of researching before this, so I'm not stalking you or anything. It's just I know you were working across like 10 different countries on 4 different continents. That's like a really cool path.
Thank
And for
you.
someone who ends up becoming a leading voice in healthcare workforce in America, like take me back. What was happening in your life during that time, and like what were you looking for?
Yeah, so I feel like the earlier part of my professional career was maybe a lot more exciting locationally than what I'm doing now. But I actually didn't start my career in healthcare. I started working in oil and gas. And so worked in a number of different locations, including a long expatriate assignment. And that's actually what got me started in healthcare. I realized that I loved being in a high reliability industry where mistakes really matter and safety is involved, but was very excited about the mission for healthcare. So I took a lot away from that environment and from that space. But when I transitioned to healthcare, one of the things that was so surprising to me, Michael, is that in oil and gas, there's pretty clear alignment that what is
Yeah.
producing revenue and what is building the business is generally property and large equipment, right? So a rig in the middle of the ocean, wells that you might have in a field, pipeline infrastructure. And humans help maintain that and they help keep the system running. And so those pieces of equipment are extremely well maintained. They do routine maintenance, scheduled downtime, because if you don't do that to a refinery, it's thousands of moving parts filled with combustible
Hmm.
fluid. One of them breaks and the entire thing explodes, and people die, and it costs tens to hundreds of millions of dollars. So when I came to healthcare, I think one of the most surprising things to me is there was not broad alignment that our humans are the core means of
Yeah.
production. I mean,
Yeah.
at our very core, healthcare is humans working with humans to heal humans. And even given that, from a financial perspective, we're not treating them as well as we might treat equipment in another industry. So we weren't doing routine maintenance, we weren't doing scheduled downtime. And so it's not surprising to me that we're seeing some of these issues with workforce burnout, disengagement, and people in many instances saying, you know what, I'm done with this. I don't have capacity for it.
Mm. Interesting you talking about upkeep and maintenance. Was there like a specific moment during the oil and gas kind of phase that you came across either a situation, you witnessed something, and you're like something clicked, and you're like, all right, I kind of need to move into healthcare. What was that?
Yeah, so I'll never forget. I was sitting on the international crude trading floor, and was had already planned my transition into healthcare. And I ran across a conversation with a colleague or future colleague, who mentioned that medical residents were working 30-hour shifts. And I said, I'm sorry, what? And they said, oh yeah, they work 30-hour shifts. And I'm thinking, okay, this human that is doing life-saving work is working 30 hours straight.
Yeah.
Why? And that
Yeah.
theme has sort of continued for the last 15 years. And I think at that time, my perception was we have built, healthcare workers are extremely altruistic, right? They're going into this work because for many, it's a passion, it's a calling. They're highly trained individuals. They dedicate their 20s and all their healthy
Yes.
years to developing these skill sets. And they're there because of a tremendous sense of altruism. And so then we built a system on top of that, right? And without altruism, that entire thing falls apart. And this was in 2010. And I think right now we're seeing the
Yeah.
effects of the system that
Yeah.
was built that way.
I mean, I think about that so much. Healthcare is full of people, many of whom are my dearest friends. They went into the field because they want to make a difference. They genuinely care, like literally genuinely care deeply. And they're just some of the most mission-driven humans I've ever come across. And yet our industry has like one of the worst track records of any sector for actually taking care of its own people. It's like if you want to have a record, like that's not the record that you want. How do you how do you explain that? Because from the outside, someone's looking from the outside in, it just seems almost paradoxical.
Yeah, it doesn't make sense, right? Um, I think there are a couple dynamics at play here. One is that because people are so committed to their patients and to the work or to the non-clinical ways that they support the mission, that they will endure things that someone who's just there for the paycheck is not going to put up with, right? So people in other industries that have a transferable skill set would just walk away and find a new job. I think in healthcare also because it takes such a long time frame to build this very unique skill set that many of our people in our workforce have, you can't easily repurpose that in a way that is still meaningful, just, outside of a traditional healthcare environment. And so I think that keeps people in a position where they're willing to endure that discomfort longer than we would see in any other industry. So then that kind of props up some of these environments and behaviors. I do think, and I'd be curious for your thoughts on this, that after the pandemic, that willingness to endure and stick with a bad culture or chronic overwork or broken systems got a
Right.
lot less sticky. And I think people said, you know what? I'm actually not going to spend my life doing this. And so we saw a huge exodus from the workforce then.
Yeah, that was like the straw that kind of broke the camel's back for a lot of people, and they were just like, you know what, like, no, not for me. I think there was a threshold that people were willing to accept, and they were just like, this is just part of the territory. This is part of the job. And then you kind of build just like a threat, like just like you're okay with dealing with that. And then it was a magnitude way higher. And I think that was the the breaking point for a lot of people, and we haven't necessarily recovered.
I think what was really interesting to me, I started researching healthcare worker well-being during that time frame. And when we started looking into what factors were actually explaining overall well-being among the workforce, I mean, my first guess would have been uh, you're in harm's way, you might die and you don't have PPE, right? Like the,
Yeah,
the real hazards of the job that we were seeing then. And what was so shocking to me, Michael, is that really the top things explaining overall well-being during that time of the clinical workforce were durable components of the work, right? Heavy workload, long hours, lack of trust, a feeling of betrayal by leadership. So I think what we saw in the data during that time was people saying, I trained for this, I'm showing up to do the work. But all of these other systems that are not supporting me are causing me this intense sense of moral distress. And that's the part I can't endure. And I think that's really a fundamental mistake that we
right.
make when we're thinking around this problem is we do not have a lack of resilience issue. Healthcare workers are some of the most resilient people on the planet,
Yeah,
but we
yeah.
have to design in ways that allow them to access their own resilience. And sometimes in our current systems, we're not doing that.
Hmm. Does more recent data show that that's still the pressing issue, or is there newer data that's revealed something else that, maybe leaders are thinking that it's another cause?
Yeah, we generally, in the research literature, would pinpoint sort of six things across industries that tend to contribute to burnout, and workload is only one of those. I think that's the one that we tend to point to the most.
So what are the
But
other five?
yeah, so other things include lack of fairness, lack of autonomy, which I think has been on a steady decline for many healthcare roles for a long time, a sense of moral distress. So I can't show up and live out my values at work. So if you think about someone who their entire calling is to take great care of patients, and you've got a broken process or system that's in the way of that, that's going to cause a sense of moral distress every day. And then a sense of community at work, which,
Right.
if I'm being asked to see an extra 5 patients a day, I'm not going to have time to ask a colleague how their kid is, how their kid's soccer game went.
Mm.
And and then lack of recognition and reward. People want to feel appreciated for the work that they do. So one of the things I'm seeing, and I'd be curious if you're seeing glimmers of this as well, is that people will say, we're really mindful of workload right
Yeah.
now, and my people are still saying they're burned out. Or people just got here, how can they be burned out? We still need them to work another 40 years, and it's because it's typically one of those other factors.
Hmm. How, I guess, how well versed are leaders on those other factors? I mean, do they know that this is happening, or is this just something that they know and are turning a blind eye to, or is it generally they're just not aware of this?
That's a great question. And I would say I've been on a journey in my thinking on this, and it's evolved
Yeah, of
over time. I think we can think of some exceptions. I'm sure we all can. You just have to read the news.
course.
But in general, I believe that most healthcare leaders want to do a good job and they want to do the right thing.
Yeah,
I don't think they always have the tools and information they need to do that. And so some of that problem is even in the way that we measure these things organizationally. So you might get a report that's a list of averages in a glorified word cloud that's telling you, okay, you've got a burnout problem, but it's not really diagnosing the why behind it or the what. So then you don't know what levers to push and pull. And so I think with everything healthcare leaders are having to deal with and manage and all of the uncertainty in the market and the information coming in, it's not surprising to me that some of that nuance would
yeah.
not be top of mind.
I'm thinking. I always ask a member some of my senior leaders, like, what's your sleep well at night number? When it comes to workforce, and I know that there's a lot of data that's out there, what is the most telling metric that you can think of that actually gives a leader a real clear picture of how healthy or unhealthy their workforce is? What's that sleep well at night number that they kind of look at on Friday and they'll be like, all right, like we're in good shape or we're not? What is that? Or is there more than one metric?
Yeah, I wish there was just one. A few that I think about though. That
Okay.
would be great.
Yeah.
Um, a few that I think about. I tend to enjoy or look at turnover intention for a couple of reasons. One is that sometimes healthcare workers will put up with things for so long that they just won't leave. And so if you're just looking at actual turnover numbers, there are a number of reasons that people stay in their organizations that have nothing to do with
Yeah.
them having a good experience or a good culture. Whether they would like to leave probably says a little bit more about how they're actually feeling in that environment. So I think that one is a real, like if I had
But
one
how do you
value,
measure that?
I mean, you ask
What-
people, do you want to leave? Essentially, I mean, it's a little more nuanced than that, but in the next XYZ time period, do you intend to leave the organization or search for another job?
Mhm.
So that's a good one. I think questions around trust in senior leadership are really important. It's interesting. We have seen increasingly in our own research that trust in senior leaders is predicting more of the story in turnover intention and net promoter score and organizational performance in some other ways than trust in supervisor. And that was not what I
Mhm.
expected. But I think healthcare workers see their work as so important, such a calling, that if I don't trust that the people up here have my back, it's morally distressing. It's not a place that I can stay. And so that is something to really
Right.
pay attention to. But we also know in the research, Michael, that those things that are predicting senior leader trust are a very small portion of that is the senior leader's
Right.
behaviors. A lot of that is happening by things in the middle. So that one metric tells you a lot about what's happening at the top of the organization and every level below it.
Can we talk about things in the middle? Because I feel like sometimes it's the game of telephone and everything might be dandy up here, but then it kind of goes through this filter and then down to the frontline workforce. Can we talk about maybe things that are misaligned? Because I feel like there's such a huge cost to misalignment. When we mentioned this in a kind of off the camera conversation, is that there's just a huge talent misalignment problem, which is a huge opportunity, by the way, for those that do get it right. It's a huge opportunity. Talk to me about that.
Yeah, absolutely. So, in every organization, we see this process of selective filtering where people sort of listen to what they want to listen to and they tend to filter out the rest. And I think as you go through different levels of the organization, there's an upward and a downward filtering process that happens. The upward process is I'm a frontline supervisor and I don't want to look like I can't handle this problem. So I'm going to sugarcoat a little bit on the way up. And that manager doesn't want to look like they can't handle it themselves. So it gets sugar-coated all the way up. And by the time it reaches senior leadership, they're like, everything's great. So it's not necessarily their fault that they're disconnected from what's happening on the front line.
Yeah.
And then sometimes the same thing goes back down, but sometimes in the opposite direction, where senior leaders will say one thing. And then by the time it reaches the bottom, it's like those villains at the top, have decided to ruin our lives. And so there are a couple of things that I tend to recommend and that I see working really well in organizations.
Yeah.
The first one is when people don't know how to answer hard questions about something
Hmm.
that's going on in the organization or the
Hmm.
environment, they are going to make up a story and the leader will likely be the villain of that story. Okay. So
Mm.
it goes a little something like, I asked for your raise, but those greedy, evil people upstairs said no, because they want that win in the moment, right?
Yeah. Yeah.
Ultimately, people don't want to work for an organization that is run by greedy, evil people. They want to wear that little soft shell black jacket to the grocery store and be super proud. And so it
Of course.
backfires. And so one of the biggest things that leaders can do is to ask their people at every level of leadership, what hard questions are you hearing? The reason I like that question better than like, what questions do you have? Or how do you need help explaining this? Is because they're not outing themselves as not understanding what's going on. They are just
Hmm.
reporting what they're hearing, right? So it allows them to save face. And I think that lends itself to a more honest conversation. And then we give them a values aligned, authentic response that positions the organization well. So that's kind of like one concrete thing that organizations who do this well are doing.
I love that. That's such a powerful question that a leader, I mean, it's such a great question. What hard questions are you hearing? Because they can basically they're databasing all these things, and then hopefully, ideally, they're aggregating them, and then they're saying, all right, here's like a training on how to deal with this. This happens, you go this route, this route. So to be doing that at such a large scale to me seems it doesn't seem so difficult. Obviously, we're human beings, we're imperfect. When it is working right, what happens when they start fielding these types of hard questions? What have you seen in terms of like good positive results?
Yeah, so I think it does a couple things. One is it gives senior leaders a much more realistic understanding of how their messaging is landing around big organizational changes, and it allows them to pinpoint potential for damage before it fully takes root. So humans are sense-making beings. Like if we have two disconnected points of information, we're going to put them together in a story. That is what humans do. And so it allows leaders to understand what story is evolving between disconnected points of information so that they can get out in front of it. What I also think it does for leaders, both at the top and the bottom, is it opens up that communication pipeline and it lets senior leaders in many ways experience the full heat of their decision making. So there are some messages that I think should not be cascaded because your lower levels of management should not have to feel the heat from your decision making, and you're immune to it. And so I
Mm,
think that also lets leaders sort of pinpoint like what are the messages that I need to be the messenger so that people can be mad at me, right? And I can handle my response in real time versus something that could be cascaded and communicated well.
that's so fascinating. So when we spoke offline, you mentioned something about trust, and I wrote it down. I actually put it on a post-it note. Um, and this is how you define trust, which is what matters to me is safe with you. Can you unpack that a little bit?
Yeah, so when I've been doing this work around trust in organizations, a lot of times people think, okay, trust is about my behavior. Like, am I being honest? Am I a person of integrity? Am I owning my mistakes? Like, those are trust building behaviors.
Right.
And yet we see leaders that are doing those things really well, but still nobody trusts them. And so what I like about this definition of trust is that it indicates a couple of things. One, trust is a highly personal perception.
Hmm.
Um, if I am getting a very complicated surgery, pretty much the only thing that matters to me in that trust relationship with a surgeon is this
Yeah.
person extremely competent. I don't care if they're like cheating on their taxes. I want this person to be great. And that's going to be enough for me
Yeah.
to trust them in that way because they're protecting what matters most to me, which is my physical health and safety. Um, it might so to bring that more into the workplace environment, what matters to me, my ability to leave work on time so I can coach my son's soccer team is safe with
Yeah.
you. What matters to me, my ability to take care of the patient in front of me and give them the best possible outcomes because you fixed
Hmm.
all the broken systems in the way is safe with
Yeah.
you. I also think, Michael, what is really important in that definition right now is I am hearing left, right, and center everywhere that, we're doing these massive tech adoptions, AI adoption, tech change is
Yeah.
coming. And it's ultimately all about trust and humans in our organizations to make sure that that investment is landing on fertile soil. And where I think this is getting sticky and organizations are saying, gosh, I think people trust us. We're trying to do the right thing. My future matters a lot to me. And I think everybody's future matters a lot to them. So if I don't know if my future is safe with you because of all of this
Hmm.
innovation and change that's happening, and you haven't made that very clear to me, I'm not going to trust you. And I'm not going to trust the technology you're asking me to use either. And so I think that definition is why we are seeing that dynamic so heavily in this moment.
Yeah. Inadvertently, I think, unbeknownst to someone, it's like they're doing things that are triggering the response, and they're like, What's going on?" Well, it's like you're doing something that's triggering fight or flight. I mean, human beings, it's either fight or flight. Uh, Um, you coined a term, human margin, which I think is really neat. I kind of want to understand where that came from because I understand financial margin and operating margin, and those have been like languages of healthcare leadership for a while. And you just decided to add a third. Like, tell me about that.
Yeah, so I have a finance background. That's my original training, and so you're probably very familiar. I imagine most people are with the phrase "no margin, no mission," and that phrase in healthcare
That's
was
right.
actually made very popular by Sister Irene Krauss. She was a nun CEO at a time where healthcare was transitioning from being run like a charity to needing to be run more like a business. And so when she championed that phrase, it was very much If we don't treat this more like a business, we will not keep our doors open and be able to care for the poor. I think over time, that phrase in healthcare has evolved into we are going to make an unpopular decision for the sake of financial performance, no margin, no mission. And what I was seeing in my work is that really, again, going back to that idea that humans are the core means of our production, without our
Yes.
humans, we have no other margin, we have no other mission. So, for example, in 2020, we were canceling elective surgeries, which is the financial lifeblood of most healthcare systems, because we
Hmm.
were preventing the spread of the virus. In 2021 and beyond, we were canceling elective surgeries because we couldn't staff the OR and the PACU. So, without our humans, we really have no operational margin, we have no financial margin. And so, my goal originally in this work is not to say that financial performance doesn't matter, of course it does,
Right.
or that operational performance doesn't matter, of course it does. And there's a lot of accountability around those, but that the human margin deserves to be on equal footing. And I was seeing from governance all the way to the front line that the accountability around the human margin was not treated with the same diligence that those other two margins were.
Mm. All right. So you've been in a lot of really interesting rooms, meet with a lot of really interesting leaders. I want a story. Like, give me a specific leader. You don't have to name them, but someone that you've worked with, who kind of came in super skeptical about maybe some of the things, some of the concepts that you've been kind of talking through today, and something changed. Like, what happened? What did they see or experience that shifted them?
Yeah, well, I'll tell you about two specific instances. The first one might be the biggest feather in my cap. I taught undergrads for many years, and they are very hard to please. And so after teaching this content, I overheard two people in the front row talking, like I was right there. I could hear them, but they were loud. And they one leaned over to the other and said, "You know, this wasn't as bad as I thought it was going to be. I only wanted to remove one of my eyeballs instead of two. So I'm out here saving eyeballs, okay, with this work." Um, so that was a big accomplishment. But another example, and this has happened repeatedly. I'll get someone who is a
Yeah,
scientist, they're a physician, they're a CEO,
yeah.
and we are making no traction with, hey, take care of your people because it's the right thing to do. They think that I'm
Hmm.
asking for kumbaya and hugs. And when I'm able to make that connection between the human margin and those other margins that they care a lot about and have accountability around, and put a lot of science and data behind this, I think there's that aha moment of this is not a nice to have, this is absolutely mission critical. And so I tend to believe
Right.
that when we come in with the same set of information, like if I understand all the constraints of a situation or a decision, we arrive at the same logical answer typically. And so my goal is to help them see or get visibility into what do we actually know about this that is
Hmm.
hard and evidence-based so that you'll arrive at the same logical decision. And so I see those aha moments happening all the time, which is the joy of my work.
What what is the hardest leader, the hardest type of leader, or organization to like reach with this work? And I say that because when you've seen a lot of things, it just seems as though even though you're doing amazing work, there's an overwhelming number of things that are happening. And to me, I've seen leaders that have gotten, say, desensitized to this. So is there like a type of leader that's just like you kind of going in, you're like, this might be a tough nut to crack. Like, describe that type of leader.
Yeah, so I think most leaders who are dealing with workforce issues in their organization, who have holes to fill, who have people that are quiet quitting, disengaging, or threatening to leave or leaving, there's not a lot of convincing that has to be done. They know they have a problem, right? They're trying to figure out how do we solve it. I think for me, the most challenging leader, there's two challenging leaders or organizations. The first one is the leader that thinks they already have it all figured out and is not open to learning or hearing new information. And I have found in general that the best leaders are those who are curious and always want to know what they don't know. And so if you already know everything, like there's not a lot that I can do with you, right? Um, the second type of leader that I see that is, I think, a challenge is the one that actually does not care about their people. And I've come across a few of these. So there are some people who like they care about
What
their
does that
people.
look like? Like, what does that look like when you say they don't care about their people? That's so hard to believe.
Yeah, it is, I would say in general, and I don't see these people often, thank goodness, and if you are one of these, I would encourage you to leave healthcare and don't let the door hit you on the way out. But
But they
no.
don't listen to this show, believe me.
Okay, good. Uh,
Well, good people here.
I think these are people who probably would not be able to even verbalize this, but here's the one behavior that I see that is a big tip off to me is they keep leaders in place in their organization who
Hmm.
are absolutely terrible to people. And so maybe this leader up here cares, but when I'm not willing to replace or manage out a leader who is being awful to their people or who is being reported to HR frequently or who has been involved in harassment or who just is a terrible person, then really what I'm signaling in is I care, but I don't actually care that much, right? I care about
Yeah.
whatever
So
else
what do you,
the person is
what do you
doing.
tolerate? What you tolerate says everything about your culture. Says everything.
Yep, absolutely. So those are my two tough ones.
Okay. Um, let's switch gears for a minute. I want to talk about Genfluence because I love this book, and I want to talk about it. There's a chapter that challenges like some narratives. I think a lot of people take as gospel. So let me ask you directly: what is like the most widely believed thing about generational differences in the healthcare workforce that your research simply says like, no, this is wrong? I feel like there's a
I
lot of misnomers.
Yeah, I will tell you, I learned so much doing the research for this book, and I didn't I drew a lot on the work of others, right? Um, the biggest aha for me was I frequently hear leaders who are very confused about what to do with Gen Z, which is our youngest major group in the workforce right now. And they feel like these people are fragile. They don't want to show up to work. They don't want to work hard. They cry when they get feedback. They call in sick for mental health days instead of showing up to their nursing shift. And the resounding theme that I hear is
Hmm.
people are so weak and fragile. Is every day a mental health day? And I will be honest with you, I was kind of in the mindset of like, yeah, maybe. Um, the research in this area has completely flipped that thinking upside down for me. So, if I could summarize to say, essentially, there were two core technologies that were introduced. Um, the iPhone in our pocket 24/7, okay, internet in our
Yep.
pocket, and social media with the like feature specifically. Those things allow people to quantify social acceptance or rejection
The
in
dopamine hit, the damn dopamine hit.
the dopamine hit, but also like it's the measuring stick, right? I don't just know if
Yes.
I'm rejected. I know exactly how much I'm rejected because this person got that many hearts and I didn't. And so those two technologies have opened up a pathway for humans that we are very sensitive to. So humans are very sensitive to social rejection or reductions in the social hierarchy. In fact, we have long
Right.
longitudinal studies in a variety of settings to show that there is a direct correlation between reduction in the social hierarchy and physical and mental health. It's not the other way around.
Yeah.
So we essentially gave people a means for that in their pocket 24/7. Now, you and I were both there, right? And the difference is that our brains were largely fully cooked when this technology was being introduced. I mean, there was some light duty construction, but like the major construction was done.
Yeah.
For Gen Z, and this is based on the wonderful work by Dr. Jonathan Haidt and Jean Twenge, um, for Gen Z specifically, their brains were in a period of development that was most open to outside influence in their adolescent years.
Mm.
So it was a fundamental rewiring of the sense of whether or not I'm socially safe or accepted. And that has led to hockey stick shaped increases in things like anxiety, depression, suicidality, actual suicide, and emergency room visits for self harm. And so when you look at
Yeah.
that data and see the fundamentally different healthcare mental health landscape that we're building a career and skills on top of, um, my biggest challenge to leaders is to reframe this as these people aren't fragile. If that was my lived experience, protecting your mental health is wise, right? That's wise,
Hmm.
not fragile. And these people still showed up to do the hard work of healthcare, knowing that it was difficult, right? So there's something to be appreciated about that.
Right. Right.
Um, that was the biggest aha for me.
I've been in many conversations where I hear these things like, man, they're just too soft. Like I can't even get, you hear it a lot. Or, hey, this new generation is just so entitled, so entitled. And it's like, well, I don't think people realize that like entitled is kind of like a learned thing. So, me as a parent, am I teaching my children to be entitled? So it's like, have we taught our workforce to be this way? And it's like, do we need to be looking at ourselves as leaders to say like, what did we cause here? So do we need to course correct? Is that a wrong way to think about that?
Well, I think there's some links to that. So I'll use the millennials as an example, and I am one. So full disclaimer, I'm going to be tempted to sugarcoat this, but millennials were the first ones that were really labeled as entitled. And when you actually look at measures over time that we've been capturing for decades of rates of narcissistic behavior or traits, um, incidents of words like "I am special," measurement along these dimensions, which is really interesting. So for millennials, 66% would answer in high school that I'm of above average intelligence compared to my peers. So in case math's not your thing, like 66% can't be above average. 78% of college freshmen would say I have above average leadership capability compared to my peers. So there was some actual data to back up this title
Yeah,
that millennials were given. What's so interesting about that, Michael, is that when you look at those graphs over time, and then you have the 2008 crash where people went from showing up at work saying, "Hi, like, where's my leadership role on day one?"
yeah,
saying, "Hi, I would love a job. How would you like to burn me out today?" Those rates plummeted. And so there is a component of this, I think, with our current workforce where
right.
we've been dealing with shortages for the last 5 years. No one can fill all their spots that has not met a new economic reality. And so some of that gets
Mm,
sorted, right? When the job market is scarce and you can't just go find a job anywhere else. So you kind of hang on to what you have and you're a little more willing to engage differently. So I think that's one dynamic like at a macro level that's playing into this as well.
interesting. That kind of leads me to my next thought because you spoke about this, which is around disrespect, and I want to sort of sit with that for a moment. What does that look like inside of a hospital? What does disrespect look like inside of a hospital? Give me the scene, how that plays out.
What makes me sad about answering this question is that probably a really honest answer is the scene looks like every day in healthcare. I mean, this is so widespread in just the lack of respect that we have in communicating with each other. But I'll give you an example that has a specific generational component.
Okay.
Gen Z is so lazy. They didn't want to work hard, right? That's disrespectful to characterize an entire generation that way based on the behavior of one
Yeah.
person or a few people, right? And so the tricky thing about this, Michael, is that first of all, disrespect is the top predictor of toxic corporate culture. So when people say it's a toxic culture, that's the number one predictor in the research. The other tricky thing about that is that there's this concept called stereotype threat. Stereotype threat is different than stereotyping, which we all know is not a great thing to do. It
Hmm.
is this idea that has been proved in the research again and again that just knowing of a stereotype around my kind of people actually can change performance. So some of the original experiments in this
Really?
area, yeah, it's fascinating. So some of the original experiments in this area looked at a stereotype that women don't perform as well in math and science, okay, which as a female scientist, I'm like, boo. Um, so they had two groups and they reminded one group of the stereotype and they didn't say anything to the other group and then they had these women do a math and science test and what they found is that the women who were reminded of that stereotype
Uh-huh.
beforehand performed worse and it's because they were more likely to second guess themselves and go back and change the answers than the other group.
Mm,
This experiment has been replicated over 300 times in a variety of sports settings, business settings, testing settings. And so I think that element of disrespect, which is you people out there are terrible, can actually change performance even if we're not treating people any differently. And I think that's something for us to really be aware of in how we communicate.
like we've known this for hundreds of years in terms of communication. Like words can be really harmful. They can also be really uplifting, which means that we do have a choice. It's like, do you say something that is going to be a culture buster, or are you going to say something that's going to be a culture builder? That's that in the space of a leader, like that has to cross your mind. Like you have a decision. Like we ultimately control that. Problem is that, sometimes, and I'll say this for myself, emotion gets the best of me, and I'll say something. I'm like, all right, probably wasn't the best thing to say right there. But like, how do you how do you do that at scale?
So I'm thinking about two things. We have a new study out looking at toxic corporate culture as reported by nurses. And we looked at how they described their culture and whether or not they believed that it was toxic. And what was so interesting to me is the top two themes were what I expected, but the order of those was not what I expected. So bullying, gossip, and aggressive behavior, I thought was going to be number one predictor. That was actually second place. Poor leadership was in the first place. And so I think when we have those things going on in the workplace, a huge element of that is because the leader's not shutting it down, right? And so there's a passivity around this or allowing this to happen that is damaging to people. And so I think that's our responsibility as leaders. The other part of that that I would say relative to your example
So
is
how do they shut it down? Like they see someone doing something like right then and there, like, hey, written up, next one, like you're gone. Like, is there just a very clear line that they draw in front of people?
my recommendation and sort of what I see working well is has a few prongs to it. The first one is that we are going to get crystal clear about our expectations for behavior before people walk in the door of the organization. And those are shared expectations that we co-create together, not, hey, sign this handbook so that when I try to fire you, I have documentation that you signed it.
Right.
Um, so some of it starts there, right? Then I think there's an element of addressing that when it's happening. Okay. And so that I would always recommend a private, personal conversation that is very much delivered in a way of we are shoulder to shoulder looking at this problem together. And so it might go something like this. You see this happening, you pull the gossiper in and say, hey, I wanted to talk to you about this. I know that you really care about this being a great environment, and I know you really care about your patients. My concern is I noticed you gossiping today, and I'm not sure that that's creating the environment that's going to help everybody feel like they can take the best care of their patients. And
Yeah.
so I'd love for us to brainstorm how we can find another outlet for some of that frustration, right?
So
If
you're
it
making it
continues
more
happening,
collaborative. You make it more collaborative in nature. So there's
yeah,
sort of a formula here, and then you set the expectation or
I
set
think
the
expectation
boundary.
comes first, ideally, right? Sometimes
Idea.
we're already down the path. I think corrective conversation comes next, and this is assuming that you yourself are not the gossiping, like that you're modeling the right behavior. Then I think if it becomes a persistent issue, that's when you might take more of a disciplinary approach. But I tend to believe that like when people get called out, a lot of people are like, "Man, I don't like that I did that either. It's just kind of how we do things here." And a lot of people would like to course correct and to be given that opportunity.
Hmm. So I have a question. It might be uncomfortable,
Oh,
but in like
I'm
a good
bring
way.
it. Bring it on.
Because you've been in the game for a while, and we both know that like healthcare is kind of slow to accept things. Um, has there ever been like a moment in your work kind of life where you generally questioned whether any of this is like making a difference, and where you thought about like kind of walking away from this fight?
Yeah, I think we probably all have our moments of doubt when we're trying to do hard things. I think for me, when those moments tend to occur is when um, I see just a direct rejection of the
Yeah.
understanding that this is a good thing to work towards, right? So people either like, it's not a problem, doesn't matter, people need to suck it up. Our work environment doesn't really matter. It's just about what we pay people. And I don't think a lot of leaders are in that space, but I've certainly had those interactions where I feel like, oh my gosh, I'm ramming my head against a wall. I think where I've had to pivot, at least on my own journey, is I'm not here to fix healthcare. I'm here to change a conversation, and I'm going to put every tool at my disposal to do
Yes.
that. And that's my purpose. Like, that's what I'm going to direct my effort and energy toward. And if some people aren't takers, then fine. Like, do that at your own peril and come back around to it when you have a people issue, right? And so, Michael, a lot of times when I hear people say, oh, we don't have a problem with this, or we don't need to do that, or focus on it, my next question is just, great. How's that going for you? Right. And if they're being really honest about their retention and
Yeah.
about their data and about their scores, it's not going that great. So, just like, okay, if you think you don't have a problem, how's it going?
All right. So for the leader that's listening right now, maybe they lead a team inside of a healthcare system or organization. They genuinely care about their people. However, they feel like those forces around them are bigger than anything that they can actually move themselves. What do you say to that person? Not like the research version, but like practical day to day that they can use to like actually incorporate this into their work.
Okay, I'm still going to talk about the research version, but I am going to answer your question. It's like I can't take off my researcher hat,
I
but
know, I know.
I know you're trying, and I would love to. I just can't do it. Um, so what I would say to that person is that the great news is, and this is what gives me hope personally. The great news is that we know in the data that most of the things that will make movement on this problem are largely fixable, largely free, and within the span of an individual leader. So, creating a culture of belonging, mattering, recognition, trust, support, encouragement, leading for hope, all of those things are things that I don't have to wait from up here to do. Now,
Yeah,
if up here's not doing it, it's going to make my job a lot harder, right? But I
yeah.
think a lot about this idea that um, if it's raining and I'm trying to hold up a bucket to catch all the rain so it doesn't land on my
Hmm.
people, water's 8 pounds a gallon. My arms are going to get tired. I'm going to wear out and it's
Yeah,
not going to work, right? It feels too heavy.
yeah.
But if I flip that and think about holding up an umbrella that is going to not keep everybody dry, but it's going to create a pocket of hope for the people
Hmm.
that I serve,
Hmm.
I could probably do that for a long time. I could hold that umbrella up for a long time. And I think that
Yeah.
mindset for me makes this work easier to keep doing, even when I don't see the fast progress that I'm hoping for.
That's a really good answer. Damn it. Hey, before I forget, can you just do like a commercial? Where can people find you, follow you, get resources, get tools? We'll obviously put this in the description, but just sort of share that with everyone before we wrap.
Yeah, so I have an active presence on LinkedIn. Certainly, if you're there, connect with me there. I write a newsletter there that I'm trying to really distill this into very usable things for leaders at all levels. I have a website where people will find me to come speak or work with organizations, and I'm always looking for partners in this work who want to go make changes together. And so, try to be as easy to find as possible.
Awesome. This has been it's been super fun conversations. It's going to be memorable because I actually had a few things that I was writing down and my freaking pen ran out. But thankfully we actually have recorded this, so I'll be able to go back through it. But I think you've given for those that are listening, um, yes, the science, the research, but more than that, I think your rigorous honesty on what's happening inside of these organizations and what does this actually take to change it. Just the visual of the bucket to the umbrella in my mind, that was like pure gold. So I'm just so grateful that you have been able to sort of sprinkle a lot of those golden nuggets in this conversation. And yeah, with all the work that you're doing, congrats and thank you for continuing on and staying in the industry. We need to have our best leaders well equipped and staying long term. That's what's going to help us out long term. So, if you're listening to this and you found it super helpful, please, the thing that you can do to be supportive would be to engage, would be to reshare it, to like it, maybe share it with a friend. That would go a long way. If you don't mind, that'd be great. And if you do have someone that you think would be appropriate to come onto the show, we always take suggestions. We look at comments. Let us know. And if there is, even a topic, that'd be fine. So again, this is a platform that isn't just about content. It actually is an interactive community. I've said this so many times, but you got to feed the ecosystem if you're going to eat from it. So this is a way of us being able to feed the ecosystem. So thank you for listening. Thank you for just being here, being attentive. Keep building with purpose, and we will see you next time on the Advancing Healthcare Innovation Show.
Thanks, everyone.
You bet.